How does analytics play into this? It's both vital and I think substantially overstated. So what's vital? Look, having data on which patients are sick, on where you're spending money on those patients, on which providers are not performing well, providing information back to providers about who their patients are that have gaps in care that they need to close, maybe get their hemoglobin A1C down, or are going to the emergency room too much. Vitally important. I think where the analytics are overstated is people talk about we're going to have minute-to-minute blood pressure monitoring or heart rate monitoring. We're going to feed that back to patients. That's going to change, or we're going to alert patients when their weight goes up too much or their breathing isn't quite right. All the studies with those kind of analytics on minute-to-minute patient outcomes or patient medication adherence, they seem to have failed, and I don't think that's an avenue that we really should go down. So is artificial intelligence, machine learning going to transform medicine? Well, maybe we could argue about what transform medicine is, but I'm actually skeptical that they're going to be the key element of transformation. There are places in which artificial intelligence, machine learning are definitely going to make medicine very different. For example, radiologists, pathologists, they're definitely out of a job in the next decade because of machine learning. Machines are going to be, you've got all these digital images, whether x-rays or CT scans or pathology slides, and machines are just going to be better at reading them and detecting pathology than human beings, and machines don't get tired, as people often say, and they learn much better by repetition. So I think that's one area. I think another area where high tech is going to be important is going to be in some elements of telemedicine, especially for rural areas, or especially for specialists that are in scarce supply, like pediatric specialists, whether cardiac specialists or GI specialists, or psychiatrists, or dermatologists. And being able to get a consultation, especially again in rural areas where you're not going to have a lot of the access to these doctors, is going to be important. Are machines going to interact with patients and they're going to give them diagnoses and manage them? No, that's not happening. And I think that's a total pipe dream that somehow machines are going to disintermediate healthcare providers from patients. I just don't see that in the future at all.